So certainly in diabetes care, I mean, one of the most important things that we do is we track outcomes, clinical outcomes in particular around, A1C testing, blood pressure, lipids. We test for renal conditions and success. So there's a lot of sort of those clinical elements, foot exams and things like that, which are a little bit more system-driven initiatives. They all require patient-centered involvement, but a lot of those can be process pieces. So a lot of systems are putting in strategies for doing point of care A1C testing and point of care retinal screening to make access to those screening needs easier. What we're finding, I think, is some of the outcome measures that become more complex, ones that are around A1C control above 9%, ED utilization, hospitalization sort of metrics, where it's not so much about implementing a step, but multiple steps, and they're very person-centric. We're finding that within our own health system, that we recognise that it's not necessarily the management of the disease, but a lot of the person-centered factors, social determinants of health factors that really drive those outcomes. And that requires a health system, to be able to be prepared for those kinds of needs and be able to address those kinds of needs to achieve the clinical outcomes that are required.